Hello, my name is Carissa and I'm doing my third year core clerkship here at Ealing Hospital. I started internal medicine in May, finished up my rotation, and I'm already halfway through surgical. Internal medicine at Ealing, whenever you start anything new, you kind of just don't know what you're doing for the first couple of days, but it's actually very exciting. You start off going to handover, you hear all the new patients that are coming into the hospital from the on-call staff, and they all get tracked to their respective teams if they're going to be on gastro or reviewed by cardio. And for the first couple of weeks, you're with Prof. Ash and the infectious disease team, which is really exciting because you do see quite a bit of exciting infectious disease that you read in textbooks that you never thought you would see in real life, like malaria and every type of TB imaginable, including TB meningitis and spinal TB. So it's very exciting and there's a lot to learn. You start off with your ward rounds with the team, and you're with the consultant who's the attending physician for all intents and purposes, and you have registrars who are like your chief residents and all the junior doctors that are all part of the team. You get to go on the ward rounds, review all the patients, see what the plan is, what's going to be done, and throughout the ward round you get taught about the different pathologies and the different treatments that are being discussed for each patient. So it really is kind of overwhelming at first because you're seeing anywhere between 15 to 25 patients in that morning ward round. And then after that you have teachings throughout the day. A lot of the junior doctors and registrars are very keen to teach you, and it's really fun and exciting, and they'll set aside a time where you can meet and go over how to do a proper abdominal exam, and we got to learn how to use the ultrasound machine right away on the first week and practice on each other and everything, and how to draw bloods, and just kind of get a feel for what you need to know how to do as a clinical physician. And after those first couple of weeks, you get assigned to different firms. For every couple of weeks, you can either be on gastro or cardio or endocrine, and you follow the team for a couple of weeks. But you do have the freedom to kind of stay longer in gastro if you really find gastro is something that you're very interested in. And while you're with the team, you really are a part of the team, which is really exciting. You get to know the consultant and the registrar, and you work very closely with them throughout the day doing their ward rounds. And as you kind of get a feel for how things are done here, you gradually start to take part and become more of a team member, and you're helping them with jobs throughout the day, whether that means doing a blood gas on a patient or doing a physical exam on a patient, and pretty much anything. It's really fun, and you get good clinical experience throughout, and the registrars and the consultants are really great about making sure if there's a patient that has a really good pathology, oh, you should really come listen to this patient in this ward, she has a really great heart murmur, you should go see if you can listen to the heart murmur and see if you can figure out what's going on. So it's very exciting, and you actually do get to take part. The other really exciting thing is doing on-call and night shifts, and I found that to be just the best experience because the on-call staff, they see all the new patients coming into the hospital, and you pretty much see everything and anything. And sometimes it's so busy, you're just running around, and you get to be a part of the team. And at one point, the registrars, they know who you are, and they know that you have experience, clerking patients and doing histories and physical exams, and they'll just say, can you go see this patient? And you literally are the first person to go see this patient after they've been seen by A&E. And you get to talk to them and take their history, do a physical exam, do an investigation, and talk to the registrar and really be a part of the team, discuss a plan for what should be done, what investigation should be ordered. And it's just a good experience to see the patients and investigate it yourself, and to let you be the doctor really for a while. And it's been a great experience. In regards to hours, you'll show up at 8:30 in the morning for handover every morning, and you can leave whenever you feel. If you're with a particular team and they've been done seeing their patients, there's no more teachings for the day, you're welcome to go home. A lot of times what I would do is find out who was the reg on call, and join up with their team and do some on-call if I found that I finished early with the other team I had been assigned to earlier in that day. So you really can stay as long as you want to stay, or if your day finishes kind of early, you can go home and do some studying. But the important thing is you just need to stay on top of your case logs. And so every week what I did is I always kept a little notebook and wrote down patients that I saw and any practical procedures that I either did or got to observe. And you want to make sure you put at least 2 patients per day. Obviously you don't put any identifying information about the patient in your case log, but just their age and sex, whatever their diagnosis or investigation was, and a brief synopsis of what you did and what you saw and what came of it. So I usually just do that. Practical things that you get to see and do is when you're assigned to different teams like gastro or respiratory, you get the opportunity to go with the registrar to go see colonoscopies throughout the day, and bronchoscopies with respiratory, and you can go to the cardiac cath lab as well when you're with the cardio team, and you get a chance to see all those practical procedures and learn about why they're doing these procedures, what they're looking for, and you get to see some pretty interesting pathology firsthand as well. You also get the opportunity to have a lot of hands-on experience. You obviously get to examine patients firsthand. Right away you're going to start drawing blood, as they call it, bloods out here in the UK. And you get to do cannulas and arterial blood gases, which I did respiratory for a good 3 weeks, so I did plenty of arterial blood gases during that time. Bladder catheters, you're going to do that. NG tubes, you'll have the opportunity to do all those procedures. You'll get to see lumbar punctures. A couple of American students had the opportunity to do lumbar punctures themselves after seeing it and under supervision, of course. And you get to observe lymph node biopsies, liver biopsies, epidurals. I got to put an LVM in a patient with the anesthetist with surgery recently, and that was pretty exciting. Great experience, and you get what you put in, and if you come in and you're enthusiastic and you're excited about what you're doing, you're going to find a lot of doctors here that are also really excited about medicine, and they love to teach, so you really will get the best of it if you really just are enthusiastic and excited to be here and willing to put in the time.